Hello, and thanks for joining us for today's webinar from the Institute for Research on Poverty at the University of Wisconsin-Madison. I'm Judith Sears-Poisson, and I'll be your host. Our webinar today is Work Requirements and Safety Net Coverage. Work requirements for safety net programs like SNAP and Medicaid are intended to promote employment among safety net program participants. However, research indicates work requirements can make it difficult to access and maintain those benefits, even among those who are eligible. In this webinar, our panelists will discuss the stated goals of work requirements and how they function in practice, as well as what they mean for the experiences of eligible individuals and families. Today, we'll be using a roundtable format to allow our presenters to share their insights in a more conversational setting, and we are very pleased to welcome three distinguished panelists. Chloe East is an associate professor of economics at the University of Colorado, Denver. She's also an IRP affiliate. Chloe, good to have you here. Michael Karpman is a principal research associate in the Health Policy Division of the Urban Institute. Michael, thanks for being with us today.
Thank you.
And Chima Ndumele is an associate professor of health policy in the School of Public Health at Yale University. Chima, thanks for joining us.
Thank you. Glad to be here.
Just a note, the views expressed by our speakers don't necessarily represent the opinions or policies of the Institute for Research on Poverty or of any other sponsor, including the University of Wisconsin-Madison. I also want to let you know that we have closed captions enabled, so you can toggle those on and off at the bottom of your screen. And we'll be posting the recording of the webinar within a day or so, and you'll receive a link to those by email as long as you registered for the webinar. So with that, let's start with some basic information about work requirements and the safety net. Chima, can you share what the stated goals of making receipt of safety net benefits contingent on work?
Sure. And thank you again for having me. I suspect that for most populations in most states, there is a concern that when individuals are getting benefit for free, such as SNAP and Medicaid, that may actually induce a disincentive to work. Right, that if your basic needs are cared for without any effort on your part, that it may make you less likely or less motivated to work. So I suspect that for most populations, kind of countering that disincentive to work or that perceived disincentive to work is the primary goal of work requirements. As a secondary goal, I think there is a kind of line of thought from some folks who think that if you make people jump through hoops to get the things that they need, you will screen out the populations that are less likely to need them, right? Or framed differently, the harder that you make it for individuals, only the individuals who truly need it will be willing to kind of jump through those hurdles. I suspect that those are that is the general framework of ideas that drive policies like work requirements.
And Chima, you mentioned in many states or in most states, is there a difference in work requirements depending on the state where a potential recipient lives?
The differences are sometimes small, but they matter. Right, in the use of exemptions, for example, which populations you're likely to exempt from the policy, the grace period that people are given to find or report work, the kind of verification timeline, for example. Are you going to have people recertify every 3 months, every 6 months, or once a year? So there are often kind of small differences in the implementation of the work requirements, but they do make a big difference.
Thank you for that. And let's now look at some of the specific programs. Chloe, can you start us off with a look at food assistance, otherwise known as SNAP? Who has to meet work requirements to receive those benefits?
Yeah, thanks again for having me here. So I'll give a little bit of an overview about SNAP work requirements, but I will say up front that it is not straightforward to say quickly what the work requirements are. And I think that is a policy choice in and of itself, the fact that the work requirements are so complicated and different work requirements apply to different populations. So I'll try to give my quickest overview, but no, there's a lot more details out there, and I'm happy to share those later if that's of interest to folks. So to give the quick overview, there are basically 3 types of work requirements in the SNAP program right now. The largest is what's called the general work requirement, and this applies to most working age adults who receive SNAP. It is relatively non-stringent compared to the other requirements that I'll talk about. So essentially, in order to meet this requirement, people have to be either currently working or not quit their job or search for a job if they are not currently working. But there are lots of exemptions in the general work requirements, which is probably why it's so complicated. The second is the so-called ABOD work requirements, where ABOD is able-bodied adults without dependents. So you should think about this as non-disabled non-parents, essentially. And this is a much stricter work requirement. In order to satisfy it, people have to work 80 hours a month or participate in some other kind of work-related, job training program or something, although that's relatively rare for that 80 hours a month. And the third work requirement is the employment and training program. Each state creates their own employment and training program, and folks who are subject to the first 2 requirements that I described can be referred to participate in the employment and training program. Although I will say, from a deep dive that I've been doing into the ENT program recently, there's big heterogeneity in terms of what that actually looks like state by state. So shouldn't think about that as just kind of one uniform program. So I'll stop there.
Thank you for that. One follow-up to kind of help us really have a clear idea of who we're talking about here. Who are people that would be getting food assistance who do not have a work requirement?
Yeah, so actually the majority of SNAP recipients are children or elderly individuals. So working age people are the minority of SNAP recipients if taken at an individual level. And then the other, and obviously children and elderly are not subject to work requirements. And then the other 2 big groups, although again, it is slightly more complicated than this, are people who have disabilities that are documented, and then parents taking care of children.
Great, thank you for that. And Michael, I'd like to turn to you now, and if you could give us similar information in regards to Medicaid.
Yeah, so work requirements are relatively new to Medicaid. They were tested at the state level under the first Trump administration, which approved demonstration waivers in 13 states. Only one of those states, Arkansas, actually fully implemented its work requirement program for an initial cohort of Medicaid beneficiaries. And that state disenrolled about 18,000 adults from its Medicaid expansion program toward the end of 2018. A couple other states got pretty close to implementation. So New Hampshire and Michigan started implementing their programs, and they were on the verge of suspending coverage for many adults before pausing their programs. A lot of these initial efforts were halted by court rulings and by the pandemic, and then the Biden administration withdrew approval for nearly all of the waivers. Currently, Georgia is the only state with an active work requirement for Medicaid enrollees for its partial Medicaid expansion, which rolled out in mid-2023. And people in Georgia, to get on the program, they have to already be meeting the work requirement in the month before applying. So that's what's happened at the state level. Now looking ahead, the House reconciliation bill that recently passed would impose a mandatory federal work requirement for adults in the who are covered by the Affordable Care Act Medicaid expansion. And that would affect adults ages 19 to 64 no later than the end of 2026. So out of roughly 80 million adults, 80 million people who are expected to be enrolled in Medicaid in an average month, approximately 15 million are enrolled through the Medicaid expansion and would be subject to work requirements. And it operates similarly, where people would have to work or participate in a work program or community service for 80 hours a month. And there would be exemptions for parents living with dependent children, and additional exemptions based on pregnancy, disability, and certain medical conditions, among other characteristics.
Thank you. And Chima, you mentioned earlier the hurdles or hoops that people have to overcome to be eligible for these programs. I was thinking about this, getting ready for the webinar, and it feels like it's a very different thing to fulfill the work requirements and to be able to prove that you're fulfilling the work requirements. And I wonder what that step of the process looks like, and how big as you said, hurdle that could be.
Yeah, it's a really good question. I'll take a step back because I think there was something that Michael and Chloe said kind of collectively that I believe is pretty instructive here, right? So the SNAP work requirements are mandatory, which means that all 50 states are engaged in them. Currently, the Medicaid work requirements are voluntary or have been initiated by the states themselves. And the reason that matters is if we look across the last 5 or 6 years, we find about 25 states that have initiated some legislative action to explore work requirements. And that will give you that delta, that additional 25 states will kind of give you a sense of which states are coming along grudgingly and which states are doing so more willingly. And that also gives us a window into how easy they make it to kind of comply with this. As you note, you're right that many people don't even call them work requirements. They call them work reporting requirements because there are indeed 2 steps here. The first is you have to be working in the way that Chloe and Michael described, working, engaged in a job program, in some places volunteering. But then the second step is figuring out how to actually transmit that information to states themselves. And for many people, that is equally as difficult, right? Are the programs digital? How easy is it to get in contact with your state? How often do you have to do this? So states have quite a bit of latitude here in their capacity to either make this easier or harder to comply with for individuals, even when they are working.
Thank you. And now that we've laid some groundwork, I really want to spend some time digging into the research that all of you have done. And I'll ask each of you to share what you found on a few different points. First is, and we kind of started here in the webinar, the concerns about impact on labor market participation if people are getting benefits, as Chima said, for free. What evidence is there about impacts on the labor market participation, whether there is an impact? Chloe, do you want to start us off?
Absolutely. This actually relates to some of my ongoing research agenda, so very happy to get a chance to talk about this. So there have been some papers that try to answer this question. It has been challenging in the context of the SNAP program because it is a federal program without the sort of natural experiments, quote unquote, that we researchers like to find to answer these types of important questions. So there has been kind of limited evidence on this until more recently, I would say. And this is really where some of my new work comes in. So in a new paper that I have out with my fantastic co-author, Jason Cook, who's also on this call, we look at whether people who receive SNAP based on the caseworker that they get assigned, whether they get a more or less helpful caseworker that sort of shepherds them through the very complicated process of applying for SNAP. based on that, if somebody sort of happens to get a more helpful caseworker, so they get SNAP benefits, what happens to their labor supply compared to somebody who happens to get a less helpful caseworker and therefore doesn't get SNAP benefits? And so what we show in this project is that people who receive SNAP generally do not have any different labor market decisions or labor market outcomes than people who are denied SNAP benefits. And we make sort of two arguments for why this is the case, because this is somewhat counter to I'm an economist, so this is somewhat counter to like a standard economic model of thinking about people's work decisions. And there's really two things going on that standard model does not account for. One is that lots of people who receive SNAP benefits face challenges to work, through no fault of their own. They have some disability that is not documented. They're taking care of young kids. They're taking care of an elderly parent, all these things that happen to all of us in our daily lives sometimes that make it hard for us to work. So that's one piece of it. And then the other is that what we show really clearly is that people who are able to work turn to SNAP when they are going through some kind of tough economic time. Often they've just lost a job. And so they turn to SNAP to sort of help them buffer the loss in resources because they lost a job. But that doesn't mean that SNAP is causing them to work less. It just means that they're turning to SNAP as sort of a source of insurance. And what we actually show is that in the longer run, those people that got SNAP during that sort of hard time are better off in the long run and working more in the long run than the people who weren't able to access SNAP during that difficult time. So I actually think it's really an important point that while the theoretical predictions are very clear and they drive a lot of the political discourse, the empirical evidence doesn't totally bear out these theoretical predictions that we've had for a long time. So I think it's up to us to help internalize that in the greater population.
Chima, I see you nodding your head. Did you want to add something?
First of all, I think Chloe's work is fantastic. Second of all, I think our work very much kind of dovetails with that. So we find that many of the individuals who lose coverage as a function of not being able to comply with work requirements are older or have multiple chronic conditions, or the individuals who rely on the state for more benefits, right? The implication there being that work requirements often kick off the neediest populations. But B, they are often populations that have difficulty obtaining or sustaining work, as opposed to the kind of trope of individuals being kind of young and lazy. As a matter of fact, you are several times more likely to be kicked off the program if you're an older individual, relatively older individual, than a kind of 20-year-old with no chronic conditions. The reality is that the definition of able-bodied adult without dependent is probably a little too narrow. Yeah, right. It does not capture the range of things that makes it difficult for individuals to engage in the workforce in the way that some might expect.
Thank you. And Michael, I'm guessing that because Medicaid and work requirements has not been kind of as consistent or long running, there might not be as much information as say on SNAP, but is there anything you wanted to add on that?
Yeah, so the evidence that we have is from Arkansas, and there have been two major studies on the experience in that state. One was by Harvard University researchers, where they conducted a phone survey of low-income adults in Arkansas and three other comparison states in the South, and they found that the work requirement reduced health insurance coverage, but had no effect on employment. The second study is one that I was involved in which we re-examined the experience with work requirements in Arkansas using national survey data and all Medicaid expansion states as a comparison to Arkansas. And we essentially reached the exact same conclusion, which was that the work requirement reduced the number of people with Medicaid, increased the number of people who were uninsured, and it had no significant effect on employment. So different data sources, different methods, but ultimately ending up with a similar finding.
It seems also that the idea of moving people onto employer-provided health insurance away from Medicaid could work in some cases, but there are a lot of jobs that don't necessarily come with that benefit.
That's right. Yeah, and we found also it had no effect on the number of people with employer-based coverage. So, in theory, the work requirement, if it worked, it could motivate people to increase their earnings and get a job that offers health insurance coverage through an employer. We just didn't see that in the data.
As people were registering for the webinar, we got quite a few questions submitted, and there were several who were asking about whether work requirements have been shown to contribute to benefits cliffs, and that's where if someone is making too much money, they can start losing either gradually or very immediately lose access to other benefits. Michael and Chima, I think you both had a little something to say on that. Michael, can you start?
Sure. Yeah. So again, I think if work requirements did what their proponents want them to do, which is to encourage people to work and increase their earnings, they could make enough income where it would raise them above the Medicaid eligibility threshold, which is for adults in the Medicaid expansion would be 138% of the federal poverty level. And then, potentially they could get coverage through an employer, or if their employer doesn't offer coverage that's affordable through the Affordable Care Act marketplaces. But there are a lot of potential challenges with that. A lot of employers in low-wage industries don't offer insurance. If they do, it's often the premiums are often not affordable, or people are not eligible if they're working part-time. And then, to the extent that people would be looking for new coverage through the marketplaces, they would be exposed to premiums that could deter them from enrolling. So, there's a chance that, people would have fewer coverage options if the work requirements were effective. But again, we just haven't seen that that's the case, that the work requirements are pushing people over that benefits cliff.
Thanks, Michael. Chima?
Yeah, I think Michael is completely right, and I think this concern is entirely plausible. The state of Arkansas, in kind of revamping their work requirements program recently, noted that individuals making somewhere between 15 to 17 hours dollars per hour, if they were working full time, would reach the threshold for when they were no longer eligible for Medicaid. Which is, as Michael says, in some ways a signal that they might be able to afford private insurance. But the reality is not that simple, right? For most individuals, that leaves them in an area where private insurance is unaffordable and responds to the kind of general concern of benefits cliff. Of the benefits cliff problem, right? Which is that the insurance that they're giving up and the benefits that they're giving up from the government are something that they would not be able to replace themselves with their own earnings. So it is a real and legitimate concern that work requirements may inadvertently, in some ways, push people off the program, but leave them in a worse position.
Thank you for that. And Chloe, you wanted to circle back on some SNAP work requirements.
Thanks for letting me do that, Judith.
Okay.
I just wanted to circle back because something that Michael said I think is just so important, and I want to make the point that it's the same is true in the SNAP case. So Michael said that the findings from the research on Medicaid work requirements are the same across different studies with different data. It's not exactly the same researchers, et cetera. And I think it's just really important to make that point that the same is true of the literature on SNAP work requirements. So what I was describing before was really like and even before we get to a work requirements question, like, does SNAP cause people to work less? And my research would say no. But then even setting that aside, if you sort of move forward and say, okay, well, we're still going to impose work requirements, and then lots of economists, including myself, have studied these work requirements that are imposed, the research is incredibly clear across many different studies, many different data sets, many different statistical methods, many different researchers, that these work requirements do not increase employment. And what they do instead is decrease people's participation in these programs. And I just think that's a really important point, because there are honestly not that many cases where us academics have reached such a clear conclusion on a research question. But I think this is one where we really do have a very clear conclusion. So I just think we want to be, we want to understand how clear that point has been made.
Great, thank you so much. I'm glad you jumped back in. And I think one of the questions on a lot of people's minds is whether work requirements have, and as they are being considered in upcoming legislation, may lead to reductions overall in safety net coverage. And I'm wondering what the research shows on that. Michael, would you like to start?
Yeah, so as I noted, I mean the sort of main example that we have is from Arkansas, where there was this disenrollment of about 18,000 people, who became, almost all of them became uninsured. They didn't transition into employer-based coverage. And these coverage losses, they were concentrated among people. We found they were concentrated among people without household internet access, so people who probably had the most difficulty with the online reporting system that the state set up. Looking ahead, we have projected coverage losses under a federal Medicaid work requirement that was modeled on a 2023 House bill, and we estimated that about 6 million adults would lose Medicaid expansion coverage under that type of bill. If all states followed the same implementation processes and had the same reporting patterns that were found in Arkansas and New Hampshire. The current bill that has moved through the House and is now moving to the Senate is actually more expansive than the one that we studied, in that it would not just impose work requirements on those who are already enrolled in Medicaid expansion, but also people would have to be meeting the work requirement at the time, in the month before, at least in the month before they're applying. And so that would raise this very significant enrollment barrier and would lead to much larger coverage losses over time. It's very similar in that sense to what Georgia is doing, where they rolled out this partial Medicaid expansion and really had very low enrollment as a share of the number of people who are supposed to be eligible, because people just couldn't overcome that hurdle of documenting their work activity, to get on the program.
Chloe, thank you, Michael. Chloe, do you have any SNAP specific information on that?
Yes. So like I said, there have been a number of studies on this that are really, really high quality and show big disenrollment effects. My recent paper on the ENT program for single parents shows about a 30% disenrollment effect of ENT. And then a previous kind of similar paper looking at ABOD work requirements shows a 50% disenrollment effect among the affected population. So these will have big enrollment effects. And then in terms of who's affected, the research is very similar to what Michael described. It's generally more disadvantaged people who have a harder time complying with these requirements. And our ENT paper shows actually, again, sort of a very similar story to what Michael's talking about. Most people who are not able to comply with the ENT requirements can't even sort of complete the first step, which is setting up an account in an online system. So it's just that sort of administrative hurdle even before we get to the how do you find a good job question that causes people to disenroll.
And just to remind us, E&T is employment and training. Is that correct? Great.
Yes, thank you. Sorry about that.
Oh, that's okay. Chima, if I'm remembering correctly, you have actually looked at people who are receiving both SNAP and Medicaid and the impact of work requirements. Can you share your research on that?
Yeah, sure. It is not completely dissimilar. It's actually quite close to what both Chloe and Michael are describing. We identify there are, I think, 70% of individuals who are on Medicaid are enrolled in at least one other safety net program. Many of them enrolled in two or more. So we thought it was helpful to take a look at individuals who are kind of jointly affected here. So the effect of SNAP work requirements on Medicaid are also quite large. We found upwards of a quarter of the targeted individuals who are impacted by SNAP work requirements lose coverage immediately and for a sustained period of time. Importantly, we find that there are no effects on Medicaid. The reason that that's important is because states are often kind of engaging with both of these populations. So imagine the kind of wisdom or the lack of wisdom in taking nutritional support away from people, particularly vulnerable people, for whom you're going to be paying for their medical costs down the line, right? So SNAP work requirements are quite targeted in that way, in the sense that they don't induce people to jump off the safety net altogether. And to Chloe's original point, any effects on employment aren't large enough to get people off the safety net altogether. So many of these people both end up losing SNAP, but remaining on the Medicaid program. Again, we find that coverage predominantly affects the most vulnerable, or preferentially impacts the most vulnerable, but it does impact everyone. One of the interesting things about our study is that we actually have the amount of benefits that individuals are getting from states. So we know that there are individuals with earned income who also lose coverage as a function of work requirements, which suggests that many of these people, as we have noted previously, may be losing coverage as a function of the administrative burden of not the work itself, but the reporting part of it. The last thing that we find that I think is worth noting is that this isn't a small blip. So in our study, we look at towns that implement work requirements relative to towns that don't. And we find that after the introduction of work requirements, it takes about 2 years for those trends to converge, right? That is, this isn't something where individuals lose coverage for a month or two and then come back on. It often takes 12, 24 months before they engage in coverage again. I think we find that the average individual loses something close to about $3,000 in benefits before those trends converge.
Thank you all for that. One thing that all of what you were saying makes me think about is there are the costs of administering a program and the cost of the benefits that are being distributed. But when someone loses access to SNAP or to Medicaid, there could be a lot of very costly short, medium, and long-term implications of that. Poorer nutrition, poorer health, not getting preventative care. Has there been any research, and how would you go about kind of measuring those indirect costs, maybe it would be considered? Anyone?
Oh, go ahead, Chima.
I'll jump in here with the shameless plug part of the program, and largely say stay tuned. But what we've done or what our group is doing, our research group, is looking at those very effects. So what happens? Part of the reason that we looked at people who are both enrolled in SNAP and Medicaid is to understand the impact of SNAP work requirements on Medicaid spending. And the like. What I can say in the moment is that it is completely plausible that individuals, particularly individuals with chronic conditions, are negatively impacted by SNAP work requirements in ways that matter for states.
Yeah, I totally agree. I think that this is an area that I would love to see more work in. So excited to see your paper, Chima. I think we already know from my work and lots of other people's work that SNAP has huge benefits for recipients. It improves children's health outcomes. It improves their educational outcomes. It leads them to get more education in the future. It leads to higher earnings in the future. It reduces their risk of early mortality. I mean, the list like truly goes on in terms of the benefits. So I think that there are lots of reasons to expect there will be these kind of follow-on effects. And then I also just wanted, I think this is related to a question that came up in the chat about sort of like economic impacts of work requirements. Again, I don't think there's a lot of great direct evidence, but I think we can clearly say from the existing work for SNAP that I'm more familiar with that SNAP has huge economic benefits on the community. I think the estimates are like $1.5 of impact for every dollar spent or something like that. So it's a big multiplier effect. And so again, I think there's no reason not to think that there won't be these harmful economic consequences as a result of work requirements.
Great, thank you for that.
I can just weigh in on Medicaid. There's just been so much research on the effects of the Medicaid expansion, which improved healthcare access and reduced medical debt, and increased people's use of preventive health care, increased diagnosis and treatment of chronic disease. So all of these positive effects of the Medicaid expansion could be reversed by a rollback of that program through work requirements. And then there are the additional spillover effects on hospitals and community health centers and other healthcare providers that would face higher uncompensated care costs, and would potentially have their financial stability jeopardized by the loss of Medicaid funding. And it's, just as Chima and Chloe mentioned, there are larger effects on local and state economies in which there's less, there are fewer healthcare jobs, there are fewer jobs in other sectors, reductions in state and local revenue, and then there's sort of a way in which these work requirements stop the counter-cyclical effects of Medicaid. So, during a recession, Medicaid enrollment expands as people lose their jobs, so they're able to continue receiving health care. But under work requirements, it could actually exacerbate the effects of recessions, where people, if they lose their jobs, they would also lose Medicaid because they're not meeting the work requirements. So there are a lot of risks, not just to the individuals involved, but to sort of the larger healthcare system and state economies.
Great, thank you all for that really great insight. Before we move on to talking about the current policy landscape and changes being advocated for by the White House and being debated by Congress, there were a couple of questions about who is and is not affected by work requirements. One question was whether college students are required to work in order to receive SNAP or Medicaid. And I think there's been a lot more awareness in the last few years that college students are often a pretty vulnerable population. Chloe, what about SNAP?
I'm embarrassed to say that the rules for college students are actually very complicated and different than the rules for non-college students, so I do not know those off the top of my head. Maybe somebody else does.
That is no problem at all. Michael or Chima on Medicaid or SNAP?
I agree with Chloe. The rules are quite complicated, but there are definitely states that have exemptions for college students who are at least fulfilling a significant amount of their time in the academy.
And Michael, I'm guessing some students, or maybe many students, have access to some kind of health service through their institution of higher learning.
Yeah, so it depends. There are a lot of students who receive Medicaid. One thing that's important to note is that this reconciliation bill it considers being enrolled at least half-time in an educational program to be a qualifying activity. But one thing that we haven't talked about is, the way that these Medicaid work requirements operate in practice, which is that under the previous waivers, states like Arkansas and New Hampshire used existing data to automatically identify people as either exempt or already meeting the work requirement, and were able to essentially exempt them from the reporting requirement. So those people didn't have to do anything. Among the people who were not automatically exempted, most either lost coverage or were on the verge of being disenrolled. And so, what happens to people really depends a lot on what states can do with existing databases. So for instance, states, they can draw on commercial and state wage databases. They can draw on information from SNAP and TANF systems. For students, they don't necessarily have information on who is enrolled in an educational program. So those, a lot of students would have to proactively report their activities to the state to show that they're meeting the requirements.
And I'll just say we have a lot of really knowledgeable people who are attending the webinar, and several people have put information in the chat about different requirements in different states. And in the interest of time, I'll just refer people there. But I think it's definitely proof of what you were all saying, that it's very complicated and it varies a lot. But really interesting information in the chat. Thank you all. One last maybe quick question before we move on to the current landscape. There was a question about non-custodial parents who are still parents with potential child support obligations, but may not have children living in the household, and whether they would be included or not in work requirement policies. And I could really see a ripple effect there if they are not able to make child support payments, things like that. I don't know who would like to field that. Chloe?
Yes, I think that's such an important point. I visited the Hamilton Project at Brookings a couple years ago, and some of the people I was working with were doing some really great work that I'll put in the chat about how our idea of what an able-bodied adult without a dependent is way too simple and does not do a good job of accounting for non-custodial parents. I'll put that in the chat, but work requirements do not account for that. So people are subject to work requirements if they are a non-custodial parent.
And what about for Medicaid? Are there implications there, Michael?
Yeah, I agree. I think, a lot of non-custodial parents with Medicaid would be subject to the work requirement and would potentially lose coverage, and their financial stability would be affected. The bill lists exemptions for parents or caretaker relatives of dependent children or disabled individuals, but I think that's been interpreted as children who are living with the Medicaid enrollee, not non-custodial parents.
Great, thank you for that. Well, not surprisingly, there were a lot of questions about the current policy landscape and changes that are being debated, and many of which have been passed by the House, but it's unclear what will happen in the Senate. I'd like to talk about what in the current bill would be dictating work requirements, either putting them in place where they haven't been, increasing them, basically what the differences are. And Michael, would you like to start with Medicaid?
Yeah, so the bill that made it through the House, it has a requirement that people are working, volunteering, or participating in a work program for 80 hours a month, or enrolled in school at least half-time, and people would have to be meeting that requirement at least in the month before enrolling, and potentially more months at the discretion of the state. And also at least 1 month between eligibility redetermination periods, which would happen every 6 months. And again, states would have the option to impose that requirement for more than 1 month between those redetermination periods. So there's some state discretion to make these work requirements more restrictive. And of course, if people are not meeting the requirement, they either have their application denied or they are disenrolled if they're already receiving coverage. One other thing to point out that's, I think, important is that people who are have their application denied or are disenrolled because they didn't meet the work requirement would not be eligible for the marketplace premium subsidies. And so they would really be without recourse in terms of coverage options if they didn't satisfy the work requirement in Medicaid.
And would that be a permanent ban on receiving that assistance?
It seems like it would be indefinite, because as long as their incomes make them eligible for Medicaid, if they wanted to get coverage, they would have to meet the Medicaid work requirement or prove that they have an exemption. And so there's nothing in the bill saying that there's any time limit on that.
Michael, you said that states would have the option to have stricter requirements. I assume that they do not have the option to have more lenient requirements.
That's right. Yeah. So, and again, there's nothing in the bill that says that states can't impose this requirement, not just for the 3 months or 6 months before people apply, but going back even further than that. It would be at the state option.
Chloe, what's new or different about SNAP requirements in this current bill that's being debated?
Yes, lots of things. I will try to sort of categorize in the way that I categorized up front when I was describing the sort of landscape as it is now. So for the general work requirements, which are the broadest ones, the main change, well, there's two changes. One is that rather than applying to people who are 16 to 59, the ages would change to 18 to 64. And then right now, people are subject to general work requirements if their youngest child is under 6, and that would change to under 7. So some interesting age changes there, but not too much else happening. Where most of the action is on the ABOD work requirement. And there's really sort of two components to this. The first is that there are big changes proposed to waivers that states and localities can apply for to these requirements. So as it stands right now, if a place, and that's defined in lots of different ways, that's kind of complicated, but if a place is going through an economic downturn, they are allowed to apply to the USDA to get a waiver for the ABOD work requirements because people may not be able to find a job, again, not through any fault of their own, but just because their local economy is not doing very well. And so the bill proposes in lots of different, very complicated ways, essentially restricting access to these waivers and making it much harder for places to get these waivers. So that's one piece. And then the other really big and important potential change that's part of the bill for ABOD work requirements is actually expanding the ABOD work requirements to include parents. So really the term ABOD doesn't apply anymore, even though they are still using that term to talk about the work requirements. But the proposal would be that now parents of children 7 and above would have to comply and work the 80 hours a month. And this includes single parents, both cohabiting parents, and then, take this as you will, only one of a married couple. So some strange rules happening there, but that's a really important and really potentially impactful change.
Thank you. Chima?
Judith, can I just note that this is part of a broader pattern that is kind of codified here in this bill, but also has been kind of running a few years back, right? So as of, I believe, 2023, in most states, work requirements in SNAP applied to individuals between the ages of 18 and 49. right? So the prospect of having that jump about 15 years didn't just happen in one bill. This has been part of a kind of slow-moving process that is kind of, however, quickly disenfranchising more and more people. Similarly, states used to have, I believe, about discretion to carve out or create exemptions for about 15% of their population. And that's now dropped to, I believe, 8%, and there are some proposals to even drop that lower, right? This is part of a kind of calculated but long-term process here to not just make work requirements more expansive, but to make them more difficult to both comply with and get out of.
Thank you. Thank you for that. What we are watching now is the House having passed the bill, barely, but passed it, and the Senate will be debating the bill ahead of the White House's imposed July 4th deadline for passage. I'd like to know from each of you what you will specifically be watching for in the Senate phase of this legislation. Chima, since you're unmuted, would you like to start?
Sure. I think I'll start where I ended, and it's in state flexibility as it relates to state flexibility, right? I told you there are about 25 states that, in the absence of any federal mandate, were looking to put in some version of Medicaid work requirements anyway, right? Their bills were going to look very much like the federal bills for the most part. The question is, how much latitude and flexibility will they give states that want to protect their beneficiaries a little bit more? How federal are their kind of federal standards going to be, and how much federalism are we going to have in allowing states to direct their programs in the way that are best for their citizenry?
Thank you. Michael?
So I guess, one thing I'll be watching for is whether there are stronger requirements that states should use their existing data to automatically exempt people from the work requirements. Right now the current bill says that states are required, where possible, to automatically verify whether people are meeting the work requirement. Actually, doing the work activities that they're supposed to. But it's very important also to identify people who are exempt because of certain medical conditions that make it difficult for them to work. Right now, there's really nothing in the bill requiring states to sort of do that automatically. And then another issue is just whether members of the Senate are aware of the potential impacts on enrollees, that this would not just affect so-called able-bodied adults who are not working, but would also result in coverage loss for many workers, many people with disabilities, and many people with serious health conditions.
Thank you. Chloe?
Yeah, I don't know that I have a great answer for this. I feel very overwhelmed by the bill, and so hard for me to pick out a specific detail that I'm following. But I will just flag that um, the work requirements part of the SNAP proposed changes are not the only part of the SNAP proposed changes. And what is extremely concerning for SNAP advocates is the movement away from federal funding of the SNAP program towards a joint state and federal funding model for the program, which estimates suggest would cut the overall program generosity by 30% or more. So there's just a lot of potential harm on the horizon. So I feel like that's where my brain is at, for better or for worse.
Especially talking about the work requirements, what kind of timeline would we be on were it to pass in the same condition as what the House passed, which I know is unlikely, but when would the first round maybe of requirements be put in place?
So the House bill would have the Medicaid work requirements take effect no later than the end of 2026, which really would not give enough time for states to stand up any kind of new data systems to put in place the verification measures and conduct the outreach and do all the activities necessary to implement the work requirements. There's also very limited funding for state implementation relative to what it took to implement work requirements under previous waivers.
And when would the SNAP requirements be going into place? Anyone? Chloe?
I don't know the exact date, but I do know that it would also be essentially immediate, I think, as quickly as it can be. Yeah.
That's
Chima?
my understanding as well.
Okay, thank you. So I do want to leave at least a couple minutes at the end for some concluding comments, but many of our webinar attendees are practitioners working directly with affected individuals and families. And I'd love to ask each of you if you have any recommendations you would give them on helping their clients navigate these potential changes to the safety net program requirements. And I know that's a huge question, but even a little brief advice would be welcome. Chima?
Yeah, sure. I'll jump in. I think so much of this is going to be about awareness, right? That is awareness of the bill, awareness of the specific provisions, right? Are you allowed to volunteer in your state? Is there job training available? Does the state kind of facilitate that? And just having folks to kind of help you navigate the system. I will, however, suggest that I think the folks that are going to have the most influence on this are going to be kind of state policymakers trying to mitigate the harm here. And that is related to the things that Michael talked about, including the use of existing systems for ex parte, as they call it, renewals, the use of kind of robust outreach to individuals, the kind of aggressive use of exemptions, and then making their systems more easy to navigate. So this needs to be a partnership both between practitioners, but they really need to be putting pressure on the state administrators and policymakers to make these systems more navigable.
Chloe, you're nodding.
Yeah, I mean, I think that was perfectly said. I don't know if I have a ton more to add. I think we have learned from lots of great research that how these programs are administrated matters so much. And so there actually is a lot of room, I think, at the state and local level to have a real impact. All the things that Chima said.
Michael, anything to add?
Oh, I agree with Chloe and Jim. I think, a big part of this is just the communication aspect of it, people knowing that the work requirements exist, having addresses updated and other information updated with Medicaid agencies and Medicaid managed care plans, so people actually get the information and having someone help them understand the information, how to request an exemption or comply with the requirements.
Thank you. We have just about time for a minute each. If you have any concluding comments, we'd love to hear it. Chloe, would you like to start?
Sure. So I guess I'll say what I've been thinking about work requirements, which kind of comes from a broader perspective. My perspective as sort of an economist coming in, thinking about what causes people to work and not work. And it seems very clear that work requirements are not going to be a solution to increasing people's work if we want that to be a policy goal. And so I think it's just really valuable when we're thinking about this discussion to pivot to what actually does increase people's work. And this is better jobs, a higher job quality, and more ability to set one's schedule, all the things that go along with that. The labor market right now for low wage workers is just incredibly challenging. And so we shouldn't sort of view this, I think, in a vacuum, and we should think about what labor market changes need to be made if we actually do want to increase work.
Thank you. Michael?
Yeah, so we started off talking about goals of the work requirement. And in Medicaid, I think one key goal that the proponents have is to reduce government spending. The only way that happens to the degree that is projected is if a lot of people lose coverage who need significant amounts of health care. And so, on the one hand, these work requirements, on paper, they're saying, people who are medically frail or have, serious health conditions should be exempt. On the other hand, they're anticipating these very, very large reductions in federal spending based on disenrolling people who use and need a lot of health care. And so there's a real inconsistency there. And I think it shows that this is not going to only affect so-called able-bodied adults. This will affect a lot of vulnerable people.
And Chima, you get the last word.
Yeah, I will keep it brief. I think the preponderance of the evidence here shows that work requirements don't kind of achieve their stated goals. They are largely ineffective, and a growing body of work is starting to show that they're inefficient as well. It's not entirely clear that there's any upside here anymore, and I believe that it's part of our jobs to let that be known to policymakers and to figure out how to translate the tremendous work done by folks in this panel and other places into policy and sustained policy. Thank you.
Thank you. And thank you all, Chloe East, Michael Karpman, and Chima and Ndumele, for sharing your time, your experience, your research with us today, as you'll see in the chat. Much appreciation for the information that you shared. Thanks to Natea Taylor for handling the tech for the webinar. And just a reminder that we'll be posting the recording of the webinar within a day or so. And if you registered for the webinar, you will receive a link to that by email. Thank you all for joining us, and have a great rest of your day. Take care.